Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us for another segment. In this segment, we're going to be speaking with Dr. Angela Mickalide. She's joining us here as Vice President, Programs and Education, American College of Preventive Medicine. She's going to discuss her involvement in the Vaccine Confident campaign. It's a campaign that addresses the rampant misinformation that led to fear and hesitation regarding the COVID-19 vaccine and a dramatic decline in routine vaccinations nationwide. Welcome to Health Professional Radio, Dr. Mickalide.
Thank you for having me, Neil.
Well, tell us a bit about yourself. Of course, you are the Vice President of Programs and Education at American College of Preventive Medicine. Give us a little bit of insight into your area of expertise, and let's talk about this decline or this fear of vaccinations.
Thank you. I have a doctorate in public health education and more than 35 years of experience in public health, and was involved in the very first U.S. Preventive Services Task Force Guide to Clinical Preventive Services. And so I've had the opportunity to now work here at ACPM for the last 2 years. And one of our major initiatives has been to combat the vaccine hesitation, which remains prevalent throughout the country, despite the approval and the encouragement of healthcare professionals. What we're experiencing today is the massive impact that COVID-19 has had on preventive health care. Our key aspects of preventive medicine, like screenings, routine vaccinations, and checkups, have taken a back seat, and we are now still in the midst of the COVID-19 pandemic. And we need to encourage everyone in America to get vaccinated, socially distance themselves from others, wear masks, and continue to exercise every possible precaution to prevent COVID-19.
Now, there was some data presented or being presented at the 2022 Art and Science of Health Promotion Conference concerning the misinformation that has led to the fear and hesitation regarding not just the COVID-19 vaccine, but just regular routine vaccines that we've been using for decades.
Absolutely. I did have an opportunity to present on the Vaccine Confident campaign at the Art and Science of Health Promotion Conference in San Diego. And the key points that I was aiming to emphasize is that more than 30% of Americans remain unvaccinated against COVID-19. And unfortunately, during these last 2 years, that 23 million children have fallen behind on their routine vaccinations. For example, only 58% of children received flu vaccinations in 2020 and 2021. And for adults, there's been a 95% drop in 2 flu vaccines and an 84% drop in total scripts of the shingles vaccines. And we know that vaccines can really prevent all sorts of complications in individuals, not just from COVID-19, but also from the flu, from shingles, and other infectious diseases that afflict our society.
Does the data include the underlying reason or the underlying opinions that have caused this drop in vaccines, this drop in the confidence of our vaccines?
Well, there's been an awful lot of research on vaccine hesitancy, and it really boils down to this. People are not sure whether we've had the vaccine long enough in our systems as a society to be able to assess its effectiveness. And that was the initial concern. But over the last 2 years, we've seen that the vaccine has been highly effective in reducing hospitalizations and illnesses. And in fact, according to the CDC, unvaccinated individuals, unfortunately, are 10 times more likely to have a COVID experience, 20 times more likely to die from COVID, and 17 times more likely to be hospitalized. So the evidence is clear that vaccines against COVID-19 are effective.
So if the evidence is that clear, Why are people hesitant about the COVID-19 vaccine? Other vaccines have been trusted for decades. Why the turn against them?
Well, there are, we have to be very sensitive to individuals' reasons for not getting vaccinated. And these include the culture in which they live, family dynamics, and circumstances related to lack of access to vaccinations. So it's not an easy one-size-fits-all response, but it's really, as we as public health professionals try to encourage more vaccinations across the board, it's really important to understand the why and then try to develop strategies and messages to that directly address the concerns that people are expressing.
What, in your opinion, based on your work with Vaccine Confident, needs to change in our society so that other health crises can be better handled in the future, much better than we've handled COVID-19 thus far, even though we're handling it much better than in the early days?
Absolutely. I think we have to make greater investments in our public health infrastructure within this country so that individuals have access to the vaccines. And access can include things such as the availability of healthcare facilities in their community, innovative strategies to vaccine in places like stadiums and in houses of worship. We also need to invest in messaging that is clear, concise, and consistent across the board. Because with the vaccine, this COVID-19 vaccine, the messages have changed, and they've necessarily changed. It's not, I have very much respect for all of the individuals and federal agencies and nonprofits who have tried their best to keep up with the science, but it's been an evolving landscape. For example, in December of 2020, we had no vaccines. I mean, we were only beginning to have 3 vaccines being granted emergency authorization by the FDA. And many Americans were showing distrust in these vaccines due to the speed of their development. We did really accelerate the pace. Fortunately, the vaccines across the companies have proven to be effective and safe, but there was a lot of mistrust there. And then in spring of 2021, millions of people became eligible for the COVID-19, but it was difficult on those early days to get an appointment. And this was one of the few times in my public health experience where the demand for an intervention exceeded the supply. And we conducted a poll with our members during spring of last year, and we learned that our preventive medicine physicians, 100% of them themselves have or were planning to get vaccinated. So they were modeling the way for the patients that they serve. Okay. Then in the summer of 2021, we had another evolution, which is a Delta variant, which was surging throughout the United States, which caused a new wave of COVID-19 outbreaks. And we were also combating the finding that COVID-19 vaccines became less effective over time. So that's where we had the FDA and the CDC recommending boosters to help enhance the immunity. And then more recently, as of October of 2021, we've got 31.5 million boosters being administered by healthcare professionals across the country. Yet, 22 million children were missing their recommended measles vaccines due to the pandemic disruptions. And now, today, in the period now, we have a new variant. We had the original Omicron variant. Now we have a new variant. So the message is, for those 100 million Americans who haven't been vaccinated at all, we need to encourage them to do so, to take the first and second dose. We also know that Omicron, this new Omicron strain, represented nearly 99% of the infections in the country, but now we have the BA2, and responsible for additional infections nationally and internationally. So just to give a snapshot of what's been happening in this country, over the last 2.5 years, we've had almost 1 million people die, and virtually all of those deaths were preventable. We also know that, we've had 81 million total cases of vaccine in this country. And it appears just in the recent days that our vaccines are effective, but the rates of COVID are going up again. So we have 60,000 new cases every day, 318 new deaths, and 2,000 plus hospital admissions. So our job as public health professionals and preventive medicine physicians is not over. We have to keep messaging on simple steps that people can take by wearing masks, socially distance themselves from others whenever possible, encourage vaccinations, encourage boosters, because we still have a ways to go in this nation to be sure everybody is healthy and safe.
And just as people such as yourself, responsible, educated, knowledgeable people working with Vaccine Confident are trying to message us into better health, there are those who are smart, responsible, and educated who are messaging the exact opposite. So I guess it's just a matter of choosing which message you decide to adhere to.
Absolutely. And I think what's important is that in all things in life that we have the dialogue and we try to better understand where each other is coming from and try to overcome any barriers to vaccination so that we have a country in which everybody is able to be safe and healthy so they can work, go to school, have excellent recreational opportunities, go to houses of worship. It's really the dialogue that's the most important in overcoming vaccine hesitancy.
Give us a website in closing where our listeners can learn more.
If your listeners would like to learn more about the work of the American College of Preventive Medicine and the Vaccine Confident campaign, they can log on to www.vaccineconfident.org.
Doctor, it's been a pleasure speaking with you. Thank you so much for lending us some of your time this morning.
Thank you very much for having me.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Angela Mickalide, Vice President, Programs and Education, American College of Preventive Medicine. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download it SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com Health Professional Radio.